number of boys Prabna எத்தனை பேர் number of boys
There shall be showers of blessing. This is the promise of love. There shall be seasons refreshing, sent from the Savior above. Showers of blessings we need. Mercy drops are falling, but for the showers we plead. But for the showers we plead. But for the showers we plead.
Now, I would like to invite Dr. Kirti G.S. Nair, Associate Professor, Department of Pharmaceutics, Innovative IIC Coordinator, the Dept College of Pharmacy and Research Center for giving welcome address. Welcome you, ma'am.
Thank you. Good morning to all. Today, we are gathered here for attending Impact Lectures. First and foremost, I welcome our Chief Guest, Dr. Satheesh Kumar, sir. On the behalf of IIC, Dept College of Pharmacy and Research Center, I invite Dr. S. Satheesh Kumar, Director, Research Publication and HOD, Department of Pharmaceutics, School of Pharmaceutical Science, Vels Institute of Science, Technology and Advanced Studies. Sir, thank you for accepting my request and give the chance to hear you. Welcome, sir. And I welcome Dr. Deena Das, ma'am, Dr. Shaiju David Alfie, and our Vice Principal Sina, ma'am. Welcome, ma'am. And I welcome all teaching and non-teaching staffs and our students. Please attend the section. Welcome you all. Thank you.
Thank you, ma'am.
Now, we move to the prime part of today's session. Talk on current trends in nanotechnology in the field of pharmacy.
Nanotechnology is a new, rapidly emerging area in pharmaceutical and medicinal field. Nanotechnology is the molecular scale fabrication of various functioning systems. Nanomedicine is well known in research field. It has shown dramatic improvement in healthcare. We are delighted to welcome all the experts and delegates to this talk. Now, make use of the session for the robust discussion on recent advancement and new strategies for current revolution in nanotechnology and nanosciences.
Dr. S. Satheesh Kumar, Director, Research Publication, Wales University, HOD, Department of Pharmaceutics, School of Pharmaceutical Science, Wales Institute of Science and Technology and Advanced Science. He is a former academic research, Vistas, Chennai. He has published 147 articles, also published one book. He has 5 patents. He attended 42 conferences and 17 training programs. He organized 12 international conferences. He is doing research in the area of design and development of nano drug delivery system for targeting brain. Now I invite the eminent personality to expel the speech. Welcome you, sir.
Thank you, Dr. Kirti. First of all, at the outset, I thank the management of Dept College of Pharmacy and Research Center for giving me this opportunity to share the knowledge and experience what I got in the past 2 decades of my research and academic works with you all people. I hope that I'm clearly audible to you.
Yes, sir. We are audible.
Yeah, thank you. without wasting the time, just I'll share my presentation so that we can move on to the core part of our discussion. Whether my slide is visible to you?
Yes, sir.
So the title what we selected is Current Trends in Nanotechnology with a special focus of its application in the field of pharmacy. So just 1 second, some crosstalk is. Yeah. Nanotechnology refers to the branch of science and engineering that focuses on design, manufacture, and application of atoms and molecules at its nanoscale. So I am not just reading the definition.
Sir, slide is not moving.
Slide is not moving.
Yes, sir. Yes, sir. We are visible.
It's not moving.
Yes. Now it is visible, sir.
Nanotechnology refers to the branch of science and engineering that focuses on design, manufacture, and application of atoms and molecules at nanoscale. This is not the definition, but it's a real fact that how this nanotechnology has developed. So people are, first of all, interested in the size reduction. In the early stages of the dosage form designing, the scientists were reducing the size of the particles of drugs and other materials, and they are finding its property varying depending upon the size of the particle. So not only in the field of pharmaceutical sciences, but also in many other areas, including engineering, civil engineering, electronics, and many parts of or many angles, this nanotechnology is very useful, and in day-to-day life we are using it without our knowledge. So this nanotechnology is nothing but reducing the size of the particle to greater extent. To the extent means greater extent means not simply in just powdering in a mixer blender or thing. We are making it into more finer and finer level in such a way that it goes to the level of atomic levels or molecular levels, so that we can able to get nanometric size. Nanometer means 100 millionth of 1 millimeter is called as a nanometer. So we can understand that it will be very small. We cannot see through our normal eyes, and also not even we can see through the normal microscopes. Okay, so that is the concept of nanotechnology, making the particles into finer size. For more explanation, I had given here one more example that, for example, you all know the periodic table. In that periodic table, so many atoms are placed depending upon its atomic size or atomic number. Here you can see the helium is having the lowest atomic size, having around 50 or 62 picometers, near to 50 picometers, and cesium atoms are larger, around having 520 picometers, and 1000 picometers makes 1 nanometer. So we can see, you can think that when we are close to nanometer, we are going into the level of molecular or atomic level. That is a concept you have to basically understand. So the next thing, nanomaterials. Materials, when they are converted into very fine particle size with a nanometric size, then they are called as nanomaterials. Why these nanomaterials are very special? Nanomaterials are just like normal materials, but only their size is different. So what the size can make, what sort of change that size can bring into. When a normal material is converted into a nanomaterial, there are a lot of changes happening in its chemical property, physical property, and biological property, as well as in other properties, including electrical and its color, and so many other physical related properties are also changing. So nanomaterials, they have some properties varying from its original normal material. When it is in a normal mode, it may be having some properties. For example, the antifungal agents. You might have heard about ketoconazole and miconazole. When they are reduced to a greater fine material, the normal dose, if it is given, it will be giving some producing some toxicity. So why this toxicity occurs when this particle size is reduced? Because there is a lot of changes happening in its physical appearance, but also its other properties like solubility and other related parameters are also varying. This makes that material more potential, more active, more reactive, because the surface area exposed is large. So if a normal material, if it is existing as a solid in as a block or in a granule form, when it is converted into or a crystal form or amorphous form, when it is converted into a nanomaterial, what happens means its property changes. Property changes means that what we can explain in a single word, but lot of changes, expected and unexpected changes occurs with its properties, including chemical, biological, and physiological properties. So this can be useful, or this change in properties may be sometimes useful for us. Useful in many aspects. See, broadly, as we talk about nanotechnology, I have to mention all those things: environmental protection, energy sources, agriculture, construction, consumer goods, electronics, biomedical research, healthcare, and so many. I have given only a few, but many areas this nanomaterials are used. So now we are concerned about the medical application. In medical application also, in research, we can have a lot of things like drug screening, gene delivery, diagnosis, and so on. Likewise, here also clinical aspects, diagnosis and monitoring, detection of diseases, as well as drug delivery. What I am concerned about today's talk is mostly with pharmacy and particularly with drug delivery. Okay, so how these nanomaterials can be used for successfully delivering drugs. What is a successful drug delivery system? If a drug delivery system could able to release the drug completely at the required site of action in the specified release rate, then we can call it as a successful drug delivery system. Once again, I repeat the sentence. What is a successful drug delivery system? What we expect from a drug delivery system? A drug delivery system should be capable of releasing the drug completely from the dosage form, and it should reach the exact site of action where the action is required at a specific controlled or required release rate. So if three things are involved, one is complete release, second one is site of action, and third one is at a required rate of delivery. So if these three things we could able to achieve through our drug delivery system, that drug delivery system is called as a successful drug delivery system. That is an ideal dosage form. Normally we call it as ideal dosage form. So whatever the drug delivery system, let it be nanoparticles, nanoshells, nanospheres, whatever we call it as, solid lipid nanoparticles, whatever name you call, it should be capable of doing these things. How far the designed dosage form or drug delivery system is capable of doing these three aspects or successfully doing these three aspects, satisfying these three aspects, then we can say that that is a good drug delivery system. So what are the nano drug delivery systems? See, normally for your understanding, say I think most of the participants are from the student category and they require a complete understanding of nanoparticles. That is the aim of my talk today. So when we talk about, say that there is a car, there are so many cars. We can call them as SUVs, hatchbacks, multi-utility vehicles, MUVs, like that. Different categories are there. Just we call them as cars. Likewise, when we say nanoparticles, there are many types of nanoparticles, many categories of nanoparticles. So whatever this nano means, it's only based on the size. But depending upon its morphological and structural variations, we can categorize as different categories or different with different names, we can call them. One is, for example, if you had given here, you can see nanosomes, nanospheres, micelles, nanocapsules, nanoshells, solid lipid nanoparticles, and so on. There are many types of nanoparticles. All these comes under the heading of nanoparticles. Okay, so that nano term is coming from basically its size, and the remaining part, whether it is a solid lipid nanoparticle or a nanocapsule, all these are coined depending upon or added depending upon its morphological, structural, and chemical composition. Variation in structural, morphological, and chemical variation. So we should understand that the nanoparticles can be made by many materials. By using lipids, you can make it. By using polymers, we can. Polymers also, there are so two categories: biodegradable and non-biodegradable polymers are there. So you can use any such materials for making this nanoparticles. Even you can use metals like silver, gold, etc. for preparing the nanoparticles. So these nanoparticles are going to be very useful as a drug delivery system if you could able to load drugs into it. Okay, so basically I'm saying that polymeric nanoparticles means the nanoparticle is made up of a polymer. Inside this polymeric nanoparticle, if you could able to load some drugs, if you could add some drug to the nanoparticles, then we can make it as a drug delivery system. A nanoparticle can be converted into, or it can be used as a drug delivery system if we could load or incorporate drugs into these nanoparticles. So advantages of nanoparticles. Most of these things you may have heard many times, but still I insist some of them here. Basically, what advantage what we get is, or what is the main advantage of this nanoparticle is, it will increase the therapeutic efficacy. The efficacy of the drug, the therapeutic efficacy of the drug is the main core aim of making any drug delivery system. So this nanoparticles efficiently increase the therapeutic efficacy. That is the ultimate goal of making nanoparticles. Here, other things what we can have is reduction in the side effect. The adverse drug reaction will be minimized due to the decrease in dose. We can achieve controlled drug delivery system by using some polymers. Then high drug loading capacity. As the particle size is finer and large surface area is there, there is a possibility of loading more drug into the nanoparticles when compared to others. Then site-specific targeting action. The nano drug delivery systems have the capacity of targeting the required site of action. So I told in the earlier slide itself that A successful drug delivery system should be capable of delivering the drug. One among the parameters is delivering of the drug at the required site of action. So this nanoparticles will definitely do this job successfully. Hence, this nanoparticle is raised or is trending in the dosage form platforms. So it is having a very good site-specific action. Then various routes of administration is possible with this nanoparticles. We can injection, we can give it orally, you can apply to the skin, or you can spray it, whatever mode you want or you wish, or the disease demands or the patient's demand is for curing the disease. We can make into that dosage form successfully, and it's having a very good stability. And manipulation of particle surfaces. I already told, to the surface we can add some agents that may improve the targeting efficiency of the nanoparticles, and a drug can be incorporated without any chemical reaction. You might have heard that when you are making some dosage forms, as a first step, we will do the pre-formulation studies. But when you are making some tablets or capsules, here and there we will come across with certain incompatibility issues, some sort of reaction between the drug and the excipients. But rarely, many of the people might have known that who are working in this nanoparticles, those who are doing some research, they might have aware of that. Very rarely we will get some incompatibility issues with this nanoparticles, because the polymers what we use, the materials that we use are very inert and they are very efficient, so that they will not produce any sort of incompatibility or chemical reactions with the drugs. So all this makes what our nanoparticles very efficient. Okay, some more things I want to emphasize over microparticles and liposomes are very commonly used, and how these nanoparticles are more efficient than these two dosage forms. The intercellular uptake is very high when compared to microparticles, and the stability of the drug is very high in nanoparticles, because they form very good compatible stable dosage form, and they do not even sediment. Even if you prepare nano suspension, you better heard that word nano suspension. Even when you prepare this nano suspension, these suspensions will not have any sedimentation, because they have a surface charge called as zeta potential. So applications of nanoparticles. Now we are aware that nanoparticles can be used as drug delivery system, and I already justified why these nanoparticles can be used as a successful dosage form. Now, where and all we can apply. See, for treatment of many diseases and disorders, we are using these nanoparticles, but due to the specific limitation of the time, I had selected very few which I think that it is very important that everybody must know. So the first one I wish to say is the cancer. The cancer application of the nano drug delivery system for cancer is very common, and many researchers worked upon it. And we can see that it can be not only used as an therapeutic agent for as a drug delivery system for cancer, but also in the diagnosis and other areas of detection of cancer also these nanoparticles are used. But with a special focus here, you can see that nanoparticles can be used as an targeting agent for cancer. So this nanoparticles will be able to identify the cancer cells, and it will get attached to the cancer cells and deliver the cancer agent into the cancer cell, so that the cancer cell will be, or the tumor cell will be destroyed. You know, anti-cancer drugs or anti-neoplastic drugs. Otherwise, we call them as cytotoxic drugs. Cyto means cell, toxic means poison. A cell killing drug. So, cytotoxic means what? If we translate into the crude words, it will be called as cell killing drugs. Cyto means cell, toxic means poison. So a poisonous substance that can kill the cells. These drugs do not know which is a normal cell and which is a cancerous cell or tumorous cell. It cannot differentiate it, and a anti-cancer drug cannot differentiate a normal cell from cancer cell. So that intelligence can be provided by these nanoparticles. If we are efficiently, smartly designing a nanoparticle, that will be having the capability to sense which one is the normal cell and which one is the cancer cell. It will not attach to the normal cell, but it can be made in such a way that nanoparticles can get attached to cancerous cell alone, so that after getting attached to that proteins, the drug inside the nanoparticle will be released into the cell so that the cancer cell is destroyed. That is a basic concept how we use this nanoparticles for treatment of cancer. This one, cardiovascular diseases. Normally, you might have not heard this nanoparticle is used for treating cardiovascular diseases. It's a very rare one. Very few researchers have worked on it because most of the drugs naturally circulates in the cardiovascular system. If a drug is injected or if you can take a tablet, after absorption, the drug will reach the cardiovascular system in the blood. So the people think that there is no need for targeting these drugs to cardiovascular system. But when we go into specific regions like heart, they have a specialized tissues where they will not take any drugs. Very rarely they will pull up the drugs, or it will take the drugs from the blood. So there is a special requirement for these special types of muscles like myocardial muscles when you want to treat the disorders like myocardial infractions. So application of various nano platforms in the prevention and treatment of cardiovascular disease is required, and it can be, these nanoparticle platforms can serve as a target for breaking down the coronary artery plaques and prevent the injuries caused by stenosis or occlusion of arteries. Sometimes you know that the arteries are occluded with some cholesterol agents or plaques, and we require to break down them. And definitely these nanoparticular drug delivery systems can do a lot of things in cardiovascular system. Also, it can act as a very efficient drug delivery system for treatment of myocardial infraction. Then for skin diseases, many nanoparticle formulations like liposomes, nanospheres, nanocapsule, etc., can be used as a cream or a lotion, or incorporated in a cream or a lotion and converted into a drug delivery system that can be applied onto the skin or the dermal region. What happens, or what is the advantage of using a nanoparticle in skin preparations? Definitely there are some advantages. The permeation enhancers can be used in such a way that the nanoparticle, due to its high lipophilicity, it will easily pass through the skin pores and reach the blood circulation. So the drug permeation, when we compare with a normal drug applied as a cream and ointment, and preparation that is having nano carrier, will definitely be different, and nano carriers can efficiently transport the drug across the skin. So this not only for the skin diseases, but also for penetration into deeper muscles like pain, treatment of pain, and other inflammations. We can use this skin preparations. Nano carriers can be used in the skin preparations. Then for cosmetics. So I used to say that whenever any student want to become a rich person in a short period of time, can anyone of you open the mic and say whether I am audible clearly?
Yes, sir.
Okay, thank you. So cosmetics, I used to say that if you want to become an entrepreneur or if you want to start a company, you must start a cosmetic industry, because in a short span of time, you can earn very good money only with this cosmetics. Because if you say, the moment you say it is a cosmetic, there is a big group of people who will purchase it without analyzing much. Whatever you say, they are going to believe. One company, I don't want to specify the name in the public platform, one company had sold their skin cream for decades together, saying that it will create fairness in your skin. Decades together, they had earned a lot of money, and at the last, I found that they changed the name of the preparation. That matter, you may also able to recognize what is that cream. So it is very easy to earn money by manufacturing cosmetics. Whatever you claim, believing that claim, there are people to purchase it. So cosmetics, these nanoparticles entered into the cosmetic area also, and many materials like antioxidants, anti-pigmentation agent, anti-wrinkle agents, sun protection factor, collagen stability agents, elasticity improving agents, etc. are included in this nanoparticular preparations and applied to the skin. But my personal opinion, maybe I may be wrong because of my lack of knowledge, but still, as far as my experience goes on, it is not ideal for adding nanoparticles into cosmetics, because this nanoparticles behave differently from the normal materials. So we cannot control them. Unless otherwise we could able to see them or sense them, we will not be able to control them. So these nanoparticles, if we are applying at different doses, see for example, a skin sun protection cream, sunscreen lotion. Some people use 1 ml a day. Some people may use 2 ml a day, depending upon the nature of the skin, the requirement, depending upon the intensity of the sun in the place where they live. It is different. But drug delivery systems or dosage forms or pharmaceutical products, it will be used in a specified dose only. See, cosmetics are like food. If you take noodles, one person will take one bowl of noodle. Sometimes some persons may take, overeaters take two bowls of noodles. We cannot say the measurement. This much only you should take. Likewise, cosmetics also, we cannot specify the dose. Depending upon the requirement, the consumer will use it. So the intensity, the quantity, concentration, all those varies from the user to user, and hence they can produce toxicity unnecessarily. So where it is required for treatment, we can definitely use nanoparticles, but for simple reasons, we should not use these nanoparticles, particularly in cosmetics. This is my personal opinion. Now we shall move to the next part of our presentation. Now I'm going to say how practically they are being used at different domains. See, all those, what I'm going to say is what we prepared in our laboratory and how we tested and what we got out of it. I'm not going to make it as a big story, but in a crisp, in 1 or 2 slides, I'll try to give some applications. So enhancing the bioavailability of an antiviral drug by application of nanotechnology. our research team had taken a tetravalent and converted into a nanoparticle. This tetravalent is a very slightly soluble drug in water, so that we could not able to improve its bioavailability by normal method. But one company called as Intelens made it by spray drying processes, and the pill burden was very high. That means the quantity of the volume of the pill was very high. That's the one drawback with tetravalent spray dried bioavailability enhancement. So there is a need for trying with other method, and we took nano suspension as a dosage form, and we incorporated the tetravalent antiviral drug into this, and we could able to successfully enhance the bioavailability. So what I stress upon here is this nano drug delivery system can efficiently enhance the bioavailability of drugs. Next, nanoparticles for the treatment of diseases and disorders in brain. So brain is a very peculiar, unique organ in our body, where we know the different parts of the body: cortex, hippocampus, frontal brain, everything you may know, cerebellum, hypothalamus, all those things you may know. So each and every part of the brain is having a specific function. If a minor variation in this organ, part of the organ, may cause a lot of difficulties: loss of vision, loss of motility, loss of speech, etc. So we should carefully treat any diseases or disorders when it is related to brain. Normally, there is a specific area called blood-brain barrier through which the drug cannot pass through, because the astrocytes will prepare a barrier-like structure with the normal cardiovascular system. From the rest of the body, the brain is separated. Even the blood composition in normal part of the body and brain is different. There we have CSF, cerebrospinal fluid, for which the composition is somewhat different from that of the normal blood. What are the methods for invading this brain? If any diseases occurs in brain, we have to treat them. What are the methods available? There is a chemical drug delivery system. We will change the nature of the drug. We will convert into a prodrug. We will alter the structure of the chemical structure of the drug, and we will try to make it penetrate across this blood-brain barrier. Then biological drug delivery systems like what we call it as endogenous transporters are used by re-engineering the dosage form. Then disrupting physically the blood-brain barrier using a needle and just trying to put the drug into the other side of the brain. Then receptor-mediated drug delivery system are also widely employed, where the transport of macromolecules like peptides and proteins are by conjugated in certain materials, and the drug will be tried to pass into the other side. So examples of transferrin and insulin are widely used. So chemical method of formation is there by altering the structure of the drug. Biological delivery systems, material that can act like that of a part of the brain can be used for transporting the drug, then disrupting physically the blood-brain barrier, that is by using a needle. You can disrupt it, or by using a chemical, you can damage the blood-brain barrier temporarily, and we can send the drug. Then receptor mediated, that's very useful, that will use certain receptors available in the astrocytes to transport the drug. So here I had clearly shown the different methods. It will be a little bit looking complicated, but actually it is easy. Transport of proteins like are useful in transport of glucose, amino acids, ketones, and self-targeting drug delivery systems. And by diffusion, some lipophilic molecules can be transported. Receptor-mediated transport is possible for transferrin, insulin, and conjugated nanoparticles. Then adsorption, that means adsorbing onto the cells and then slowly moving across the cell is also possible for certain cationic nanoparticles and liposomes. So blood-brain barrier is present. When we require to move the drug from the other side of the blood into the brain, we require a specific mechanism, or we have to adopt a specific transportation system for transport of the drug across this barrier. Why we select nanoparticles as one of the drug delivery system for transporting the drug across the blood-brain barrier? Because they are small, stable, safe, precise, and active. So these are the basic reasons why we select nanoparticles for brain targeting. Here we have some examples. Polymeric nanocarriers for delivery of cytotoxic drugs across the blood-brain barrier. Certain anti-cancer drugs are efficiently transported across the blood-brain barrier when a patient is suffering from a tumor in the brain. So we prepared nanoparticles of nascopin. Nascopin is an anti-cancer drug, or it is a drug that can be used alternatively for treatment of cancer. This is loaded in caprolactone polymer-based nanoparticles, and they were sent across the brain successfully. So this nascopin-loaded polycaprolactone nanoparticles were found to be very successful in enhancing the rate of delivery into the brain. Then we have certain antimicrobial effects. Sometimes certain infections occurs in the brain, particularly diseases like meningitis, which is occurring in the brain. So loading of antimicrobial drugs for treatment of infections in the brain. Meningitis is a disease which occurs due to certain microorganisms entering into the brain, and the difficulties in treatment of these infections is already the presence of blood-brain barrier allows only very low concentration of the drug into it. Because of that, the microorganism will become very defensive against that drug by producing certain sort of proteins. It will become a drug resistant within a short period of time as the microorganism is exposed to very low concentration of the drug. We prepared ansamycin loaded nanoparticles, and this ansamycin nanoparticles had been efficiently transported across the blood-brain barrier. Particularly, a significant increase in the bacterial load is noted after 8 hours in the normal one, but the same is reversed back when the nanoparticle treatment is provided, so that we can understand that the effectiveness of the ansamycin was enhanced multiple times by incorporating it in nanoparticle drug delivery system. So this is a publication arrived out of that, and we had started this journey not now. In 2004 itself, myself and another one of my colleague, Dr. Surya Prakash, had involved in preparing a formulation containing nanoparticles with cefotoxime sodium. It's a very popular antibiotic, antibacterial agent, so that we could able to achieve a prolonged treatment, prolonged time of drug release in the body. So with this, I stop this presentation. I hope that we could able to understand what is a nanoparticle and how these nanoparticles are used for various trending areas of research today. Now I thank Dr. Shaiju Davi Alfi, the Managing Director of Daleview College of Pharmacy and Research Center, Dr. Deena Das, the Chairman of this institution, Dr. Sina Hedge, the Vice Principal of this institution, and also Dr. Kirti G.S. Nair, who is the backbone in arranging this lecture. I hope that it is useful, and I'm stopping here for interaction. I think that we'll be having many doubts, so that you can discuss freely with me regarding this. Okay. So the session can be open for discussion now. I cannot hear. One of you can just get the question and ask me. No issues.
Thank you, sir.
Yes, some questions are coming up there. Excuse me. What is? Part of? I'm not audible clearly. Can you, someone of you can get the question from her and convey to me? The audio is not clear for me from there.
So
Sorry, madam.
nanofilm.
So, can you repeat the question, madam? Not audible here. It's breaking. Voice is breaking.
So what are nanofilms?
Nano fillings.
Film.
Nanofilms. Films, basically, as the name indicates, they are very thin in structure. They can be used in certain mucus regions. They can be attached to certain mucus regions where it can release the drug efficiently. So, thin sheets or thin films containing this nanoparticles are called as nanofilms. Morphologically, they are made up of nanoparticles, but they will be in the form of films, and the structural variation, nanospheres means it will be spherical in the shape, but here it's given in the film form so that it will be thinner in the morphological structure, and it will be efficiently transporting the drug across the mucous membrane very particularly.
So how are safety tests carried out in nanotechnology?
Yes, you are a very good question. Actually, nanotoxicity is a special area which we should definitely think about it. When I'm talking about the skin preparation itself, I told that it's not, I'm not personally recommending this nanoparticles for skin preparations or particularly cosmetic uses, because they can produce toxicity. Say, for example, a very simple example I can say so that you can understand very clearly. If a glass bottle kept on your dining table falls down, what happens? It will break. You'll be able to clean it very clearly out of that floor if it is visible. Depending upon the visibility, you can remove all of them. Otherwise, it will hurt your skin or legs. But these nanoparticles, it is completely not visible to eyes, not even for normal microscopes. Particularly, their behavior is also very different from that of the normal materials. So in such condition, if we administer this nanoparticles for where it is not essential, when we use it for very simple reasons, then it is going to definitely cause some sort of issues, particularly toxicity. Many researchers had discussed about the safety and toxicity of these nanoparticles, and their view is also, which is very similar to that of what I indicated. Unless and otherwise the biological safety is proved, it should not be sent to the market. Even though, for example, one drug X is there, if you are converting the drug X into a nanoparticle, again, you have to perform all the safety tests for the X nanoparticle, because the drug X behavior will be different. The drug X in the nanoparticle form will be having a different behavior in terms of safety and toxicity. So a specific safety profile has to be generated. Legally also it is very required, so that only it can be brought into the market. So as like a new drug molecule, we have to consider this nanoparticular formulations, and we have to perform the safety test and toxicity test in its drug discovery.
So what are the main challenges in nanotechnology?
Challenges. As you specified, it is a challenge only because preparing, and those who are prepared this nanoparticle, they might have be aware of the challenges very normally, because first of all, achieving the particle size in a pilot scale itself is very difficult. Normally in the laboratory scale, we prepare some 10 ml or 20 ml of nano formulation. It will be very difficult to achieve the required size. By a lot of optimization procedures, optimization protocols, we have to follow to achieve the required size. And then the stability. Unless and otherwise the zeta potential is plus or minus 10 or above, we cannot expect a good stability. So stability is an issue, then achieving the particle size is an issue, even at the pilot scale. Again, generating this or preparing this nanoparticle in a large scale is definitely a big challenge for the industry. Most of the preparations what we have in our journals and books are only suitable for small scale preparation and not for large scale preparation. Only 1 out of 100 procedure what we have is suitable for using in large scale production. So I feel that large scale production is going to the major challenge in making this drug delivery system as a commercial product. Please feel free to ask the questions. No need to worry that you will ask wrongly or without understanding. Don't think like that. You can freely ask the questions, because you're all students, and the primary aim of this guest lecture itself is to throw knowledge upon and introduce the drug delivery system to you, not give a very high level of research inputs to you. So you can feel free, even the teachers who are listening to this program can also ask the questions if they have something in their mind when they are doing the research. Some hurdles might have arrived, and they can be free enough to talk with me.
Thank you, sir, for your valuable talk. Surely it will be a worthwhile talk for all of us. Mainly, it is the recent advancement and new strategies for the current revolution in the nanotechnology and nanoscience. Thank you, sir, for your valuable talk.
Thank you very much for providing the opportunity. I specifically thank Dr. Kirti G.S. Nair and the team for giving me the opportunity to talk with the students. I hope that you might have understood something, and it will be useful for in your future for taking up a nanoparticle as a research tool for performing your higher degrees. When you are performing your higher degrees, you can select this nanoparticle as one of a tool for research. And I wish you all the success. Once again, I thank the management of Delhi College of Pharmacy and Research Center, and Kirti, and Dr. Seena Madam, Dr. Leena Das, Dr. Alfi sir, and all the members of teaching and non-teaching faculty members of this institution for patiently listening to my talk and utilizing me. Thank you. Thank you very much.
Impact Lecture Series. Dr. Satheesh Kumar, Director, Research Publication, Wales University, HOD, Department of Pharmaceutics, School of Pharmaceutical Sciences, Vistas. Respected representatives of the management of Delview Group of Institution, Dr. Kirti G.S. Nair, students, and my dearmost members of faculty. A warm good morning to one and all. It gives immense pleasure for me expressing my wholehearted thanks, a great success. First, I extend my profound thanks to Dr. S. Satheesh Kumar, Director, Research Publication, Wales University, HOD, Department of Pharmaceutics, School of Pharmaceutical Sciences, Vistas, who even in his hectic schedule found enough time to come amongst us and ponder his vast knowledge pertaining to the area of current trends in nanotechnology in the field of pharmacy by sharing his expertise in this subject. I could like to extend my wholehearted thanks to you, sir. Thank you, sir. We, on behalf of the students and teachers and management of Delview College of Pharmacy and Research Center, looks forward for your kind support, encouragement, and your guidance, and many more talks pertaining to the relevant subject in the future too, sir. Once again, thank you, sir. Next, I could like to express our wholehearted gratitude to the members of management of Delview College of Pharmacy and Research Center for providing us all the support in every activities that we organize in our institution. We are indebted to you and thank you all. Next, I extend my wholehearted thanks to Dr. Kirti G.S., Associate Professor, Department of Pharmaceutics, Innovative IIC Coordinator, the Delview College of Pharmacy and Research Center, who had delivered the welcome speech. And thank you, ma'am. Next, I extend my wholehearted thanks to the students who has assembled on this platform. And I'm sure that the lecture which was delivered by Dr. G.S. Satheesh Kumar, sir, could have enriched your understanding of the subject. And I extend my wholehearted thanks to all the students who are present on this occasion and made this lecture series a grand success. Thank you all. I am overwhelmed by the great extent of support which was extended to me by all the faculty members of our institution who bear the credit of every event that takes place in our institution and makes it a successful one. Thank you all. I take this opportunity to extend my warm regards to all the members who joined this online impact series from outside the institution. Thank you all. And at last, wishing that we will be able to organize more such events in the future too. Thank you. Thank you, one and all.
Thank you, ma'am.
We hope that it was an informative session for all of us. Once again, thanks to the hard work that all have done, IIC coordinators, teachers, organizers, and students to make this possible, and what you witnessed was really their efforts and hard work. Now, we can end up the session with the national anthem. Please rise from the seats.
Thank you to all.
Thank you, sir.